What if treating your anxiety didn't mean taking a pill every single day for the rest of your life? What if 1 or 2 carefully guided sessions could do what years of daily medication haven't, without the side effects of medications like numbness, weight gain, sexual dysfunction, and withdrawal, while at the same time taking care of the excessive worry, racing thoughts, sleepless nights, and feeling on edge? I'm Dr. Air, quadruple board certified psychiatrist and anxiety expert. I've treated thousands of people struggling with anxiety, and I want to be clear about something before we go any further. I'm not anti-medication. I prescribe medications regularly. They can be game changers. They save lives. But I also believe that the future of anxiety treatment looks very different from what most people are experiencing right now. And one of the most exciting developments I've seen in my career is happening right now in clinical research labs with a compound most people associate with the 1960s. Now, if you've been on anxiety medications for a while, you already know the complicated relationship that comes with them. Maybe they helped at first, maybe they still help, but somewhere along the way you started wondering, why do I have to take this every single day just to feel okay? Why do I feel anxious even on the medication? Why does stopping feel so hard? Here's what I say in my clinic all the time. Someone comes in after years on an SSRI, it helps in the beginning, but now the anxiety is creeping back. The dose has gone up, the side effects, weight gain, emotional blunting, low libido are starting to feel like a second problem layered on top of the first one. And they're exhausted. This becomes more common as we get older. Chronic stress over years or decades changes how the nervous system responds. For many adults in midlife, hormonal shifts, accumulated life pressure, and metabolic changes can make anxiety harder to treat with a single daily pill. I'm not saying medication is wrong. I'm saying medication alone is often incomplete. And that's exactly why what I'm about to share matters so much. In a moment, I'm going to introduce you to a specific compound currently in clinical trials that is showing something researchers haven't seen before: rapid, lasting anxiety relief from just 1 or 2 sessions. But first, I need to give you the context that makes this make sense. You've probably heard the phrase psychedelic-assisted therapy in the news lately. Psychedelics are a class of compounds that temporarily alter perception, mood, and brain activity. They can change how you think and feel. Examples include psilocybin, magic mushrooms, LSD, MDMA, ketamine, and ayahuasca. Psychedelic-assisted therapy is not recreational drug use. It is not someone sitting alone in a dark room having a wild experience. It's a structured, clinically supervised process in which a carefully selected compound is administered in a controlled setting, with trained therapists present before, during, and after the session. Think of it like a snow globe. When you have chronic anxiety, the snow has settled into one fixed pattern at the bottom. The same thoughts, the same fears, the same responses every single day. What certain psychedelic compounds appear to do is shake the globe. It temporarily suspends everything, lifts the settled patterns off the bottom, and creates a brief window where the brain can reorganize before things settle again. The goal is that when the snow lands this time, it lands differently, better. This is what researchers call neuroplasticity, your brain's ability to form new connections, new patterns, new responses. It's not erasing the past, it's giving the brain a window of flexibility it doesn't normally have. And that window, when used with proper therapeutic support, can lead to changes that last far longer than the session itself. This is not fringe science anymore. Johns Hopkins, NYU, Imperial College London, some of the most respected research institutions in the world are publishing on this. Now, let me tell you about a specific compound that has my attention. It's called MM120. MM120 is a pharmaceutical-grade, highly purified form of LSD, lysergic acid diethylamide. It is currently being studied in clinical trials specifically for generalized anxiety disorder. I know, LSD. That word carries a lot of history, but here's what's important. MM120 is not street LSD. It is a precisely dosed, rigorously manufactured compound developed specifically for medical research. The purity and consistency are completely different from the street drug. and the early results are genuinely remarkable. In a phase 2 clinical trial published in 2024, adults with generalized anxiety disorder received a single dose of MM120 in a supervised clinical setting. At a 12-week follow-up, a significant portion of participants showed meaningful reductions in anxiety symptoms after just one session. One session. Compare that to an SSRI, which requires daily dosing for weeks before it even begins to work and often needs to be taken indefinitely. Before we talk more about MM120, let's talk about what is actually happening in your brain. You see, your brain has a network called the default mode network. Think of it as your brain's background narrator, the voice that replays worries, rehearses worst-case scenarios, and keeps your nervous system on high alert even when there's no real threat. In people with chronic anxiety, this network is often overactive. It's like a radio that never turns off. What compounds like MM120 appear to do is temporarily quiet that network. And in that quiet, the brain seems to reorganize. Old fear responses lose their grip. New calmer patterns have room to form. Researchers describe this as a kind of brain reset. And unlike daily medications that require constant presence in your system to maintain their effect, this reset appears to persist long after the compound has left the body. That's the part that makes this scientifically fascinating. If this is the kind of content you want more of, real science, no hype, no oversimplification, make sure you subscribe. I break down the latest research in anxiety treatment every week, and some of what's coming is going to surprise you. MM120 is not yet approved by the FDA. The FDA is the government agency that decides whether medicines are safe and effective for people to use. But the FDA granted MM120 Breakthrough Therapy designation. This is a special status the FDA grants to medicines that might work much better than existing treatments. When a medicine receives this designation, the FDA works more closely with the company and reviews it more quickly. This means MM120 may become available sooner than usual. According to MindMed, the research company behind this new drug, the final phase 3 study results should be ready in the second half of 2026. After that, the FDA will review all the information to decide whether to approve MM120. Now, before I talk more about the possible risks and side effects of MM120, here's what I tell every patient who asks me about emergent treatments like this. Your brain still needs a foundation. If you're sleeping 4 hours a night, running on caffeine and cortisol, eating in a way that spikes and crashes your blood sugar, and carrying years of unprocessed stress in your body, no single intervention is going to hold. Speaking of sleep, if you're struggling with this, I've put together a free sleep guide in the description below. MM120, if it reaches approval, will work best in people whose nervous systems have some foundation to build on: sleep, nutrition, inflammation control, stress regulation, gut health. I also want to be straightforward about the risks and side effects. Psychedelic-assisted therapy is not appropriate for everyone. People with a personal or family history of psychosis or bipolar disorder face real risks with compounds that alter perception and brain activity. The experience itself may be intense, emotionally confronting, disorienting. Without proper preparation and a trained guide present, that intensity can become destabilizing rather than healing. There are also unknowns. Long-term data is still limited. We don't yet know who responds best, what the optimal dosing looks like across different populations, or how it interacts with other medications in every scenario. And because this is still under FDA review, anything outside of a registered clinical trial is unregulated and carries serious risk. In the meantime, if you want to understand more about how your nervous system drives anxiety and what you can do about it starting today, watch this next video.